You're listening to the RN Mentor, a podcast designed to document and bring you the work and experience of some of the most influential nurses in our profession. We will be sitting down and having a discussion with the leaders of today's nursing world as they share their work, how they navigate their nursing path, and their views on the future of the profession. My name is Ali Tayeb. I am a registered nurse, United States Navy veteran, a Jonas Veterans Healthcare Scholar, and your host for the RN Mentor. Hello, and thank you for joining us one more time with the RN Mentor podcast. I am being joined by Dr. Tamryn Gray. She is a health services researcher at Dana-Farber Cancer Institute and Brigham and Women's Hospital, and an instructor in medicine at Harvard Medical School. Additionally, she holds a clinical administrative role in the DFCI division of stem cell transplantation and cellular therapies. Dr. Gray earned her BSN and MSN from the University of North Carolina at Chapel Hill, master's in public health from Harvard, and a Ph.D. from Johns Hopkins School of Nursing, where she was a Robert Wood Johnson Foundation Future of Nursing Scholar. Dr. Gray also serves as the co-chair for the Caregivers Special Interest Group within the American Psychosocial Oncology Society, and co-chairs the Health Equity and Anti-Racism Special Interest Group within the Palliative Care Research Cooperative Group. Dr. Gray is a 2020 Academy Health Diversity Scholar, current Cambia Health Foundation Sojourn Scholar, and current Robert Wood Johnson Foundation Harold Amos Medical Faculty Development Scholar. Her clinical expertise is in the pediatrics, hematology, oncology, and blood and marrow transplantation. Welcome to the show, Dr. Gray.
Thank you so much, Ali. I am ecstatic to be here. Thank you for the kind introduction. It's really wonderful to be able to finally connect with you.
It's great to connect with you. We have been connected through social media for quite some time. I follow you on social media.
That's right.
And I am familiar with some of your work. And by the way, for our listeners, we have Dr. Gray's full bio, which goes into much more detail as to the incredible work that she does on my website. So if you when you visit the website, you will see her full bio and you can connect with her through there. And just reading the brief version of your bio, I'm like, when do you do anything else? Because it feels like you are so, and I read your full bio, I'm like, oh my God, when do you do anything else? So before we get into the details of everything you're doing now, I want to get into my initial first question with all my guests is, how did you get started in the world of nursing?
Yeah, that's a great question. When thinking about nursing, it was not something that I knew, automatically that I wanted to do when I was younger. I actually had a mission to become an educator, believe it or not. I think with the combination of loving math, I loved calculus in high school. I don't use those skills right now in nursing. I also love science, but I also love the arts, the humanities. So for me, nursing was such a great blend. So personally, I'm a first generation college student. I have a twin sister and an older sister. And when we were growing up, our parents and grandparents spent a lot of time servicing the community. My grandparents would visit the sick and shut-in, which are individuals who were sick at home and unable to really go out and do things. So my grandparents would go to them. My parents would call and check on relatives, check on strangers, just anyone in need. So I think intuitively, I knew my life's passion was always going to be about serving and helping others. So for me, nursing was kind of a natural progression. I think what really solidified it for me was I'm an avid volleyball player. So when I was in high school, one of the players' parents is a nurse, and I gotten sick one day from a knee injury, and she came out on the court, and she kind of helped to make sure that I was okay. And this particular individual, was such a role model to me. She was a nurse practitioner, and I asked if I can shadow her. And growing up in North Carolina, I went to the local hospital where she was, and she worked in the bone marrow transplant unit, and she was as a nurse practitioner, and she was also a bedside nurse on the critical care floor. So I was able to kind of watch her and shadow her, and I knew that between blending in all of the IV lines and patient education, engaging with family, but also knowing the pathophysiology and keeping up with the latest clinical trials in transplant, she just had the best career. So I think just having role models, parents, grandparents, and people who are willing to take me on really helped me to pursue nursing.
Wow, that's amazing. Now you took your first steps, and you mentioned you went to the University of North Carolina. Now, when you went into the world of nursing based on your influence and your between the role model that you were looking at and your parents and grandparents with a sort of that were service minded, which is awesome. Now, how did you decide like which specialty area you're going to be working at, and how did you decide you were going to go for a higher level of education, like your master's and well, you got your master's in public health, and then you went back and you got your PhD. How did you? Well, actually, you have an MSN and an MPH, so you have two masters. So, how did you decide that that's the arena you were going to go into?
So when I was at UNC and I was a nursing student, I was really drawn to oncology and bone marrow transplant, partly because of the uh, the nursing mentor that I mentioned earlier, but also having the fascination of knowing about current research, clinical trials, having a connection with patients and families. These individuals would be in the hospital for months at a time, and as a nurse, being able to see them early in the morning at 5 o'clock and middle of the night drawing labs, you hear and you get to connect with them and learn about them in ways that many other disciplines aren't able to. So for me, I was naturally drawn to oncology and transplant just because of the human aspect of it, but also keeping up with innovative ways to really help cure these individuals, or at least give them a good quality of life. Um, and so that really sparked my interest in oncology and bone marrow transplant. Typically, I will work with pediatric patients, and with that comes the families. So really engaging with the parents early on, letting them know about what's happening in terms of everyday plans of care, also what decisions mean for them in the context of their loved one. Just having really difficult conversations with them is something that I kind of grew in terms of getting better at over time, because it's not easy having those conversations when you're a 21-year-old new grad. But I also saw a lot of death and dying
Hmm.
in those situations, which really led me to think about, with the quality of life that remains, how do we make sure that patients and families have good memories despite the challenges of this, devastating diagnosis. So after that, I've been a nurse for about 11 years, but I've been in transplant longer, just in different roles as a nursing assistant and such. But after a while, I really enjoyed the one-on-one connections with the patients and families, but I really wanted to think about, how do I have a larger impact? How do I really think about meaningful ways to answer the questions that I constantly had in clinical care? For example, I've seen patients of color die unnecessarily and preventively by something post-transplant related, where if she had been able to articulate and kind of share her concerns early on with the team, it probably would have been prevented. So I thought about, those scenarios. I thought about the families when I would administer chemotherapy right before a transplant. The first dose, and the mom would stop me and say, "Wait, what am I doing? Should I be doing this to my small child?" Um, so I had a lot of questions, just clinical questions, leaving every day after work. So I decided to, think about what this means in terms of my next steps. So with that, first I wanted to actually invite more undergraduate students to learn about nursing. So that's how I got my master's in nursing education. My nurse manager used to joke and said that I will educate the families like all the time, and probably the new nurses too. I'm not sure, but I think just inspiring others to learn about nursing, to diversify the workforce, to be able to see me as a role model, because the patients that we cared for were coming from all different backgrounds, and I just saw that in nursing, we didn't have that to represent, the patients and families that we care for. So I think that really inspired me to go and pursue the master's in education, where I was on faculty at the University of North Carolina at Chapel Hill for 3 years. I played a big role in helping to diversify the workforce through different grant mechanisms where we wanted to expose individuals across the state about nursing and about the different nurse scientists that are involved. Mind you, I wasn't a nurse scientist at that point, but I was just a part of the team, which was an awesome opportunity. And after that, the burning desire to address certain questions that we were kind of seeing in oncology never left me. So I decided to pursue a PhD at Johns Hopkins University, where I received stellar research training and mentorship in the areas of family involvement and decision making in the context of cancer.
Oh, that's awesome. Now, you mentioned you were in a role that was meant to diversify and educate the workforce as far as nursing goes. What did that work entail? Because I'm curious, because I always ask anybody who has had any kind of hand in this arena, I'm like, how did you do it? So
Yeah, so I was actually a co-investigator for a HRSA-funded grant that focused specifically in attracting individuals of color into the nursing profession. So we were really targeting individuals who are of color, men in nursing, and other underrepresented groups. So they would come into the campus and meet with the current faculty members, but also learn about the research that's happening, learn about nurses who are in practice. They would share their stories. We'd go over with them in terms of discussing their goals, in terms of what they may want to do career-wise and why nursing may be a good fit for them. And we also addressed any kind of traditional roadblocks that they would likely encounter, such as sometimes exam grades are barriers to admission. So we helped advise them on ways to be able to be competitive for the application process.
now, were you looking at just general population? Were you hitting like high schools or junior high schools? And some people say, get him early and get him like in preschool sometimes, so like when do you get to them so it's a smoother transition?
I think this question may be a surprise. This answer may be a surprise to you, but I think it's important to target people at many different time points.
Mm,
And I say that because when I was an undergraduate at UNC, I led this initiative where we attracted middle school students. And they were actually Girl Scouts, getting them exposed to nursing early on. It was a day that they spent on campus at the School of Nursing, and they had hands-on didactics, videos, simulations. They were able to really get in there and see what it's like to be a nurse. And that was such a great opportunity for them. It's been it was a program that's been around for several years. So I think peaking them early, even before high school, is important. I think that reinforcement later on in high school and also undergraduate is also important, as well as uh, students who are in community colleges. So it's not
mm.
just the undergraduates in typical four-year universities. It's also those who are transfer students or people who are kind of in between degrees, or people who are in community colleges.
Yeah, yeah. I agree. I always tell people that I think junior high school has always been sort of like my go-to, because by high school they're already selecting colleges or programs they're going to get into, and if they haven't had the exposure to the profession of nursing, or they traditionally see what they see on TV and who represents nursing on TV. It's not necessarily the diverse population we're looking to have at one point in the profession. We're not a very diverse profession right now, but and representation matters, and I 100% agree. But I like the idea of hitting them on multiple points in their life or in their career. So that's a great point. That's a great point. Thank you for
Yeah,
sharing.
I like to think that sometimes these these students may not have any other exposure. I think about myself. I was just fortunate to to be surrounded by individuals who are willing to take a chance on me, to be willing to ask me the hard questions in terms of what is it that you want to do? Do you want to come and shadow me? Do you have any questions for me? And I think just in general, from a human kind of a human side of things, it's important to recognize that any encounters you have with people, you want to bring your best self. You want to be a light to individuals. You never know what people are going through. You never know what their environment looks like and what exposures they've had.
Right.
So I definitely agree, just kind of meeting people where they are at different time points.
Yeah, and even with my own students, I use this. I always say this. I use these podcasts with my students, and so many students. And part of the assignment is that they write a reflective assignment, a reflective like one paragrapher, nothing too major. I don't grade them for grammar or APA or anything like that, even though sometimes they do APA. I think it's just embedded in them at that point. But what they do is a lot of times they'll share that, oh, I didn't know nurse, even though they've been in the nursing program for such a long time and they're about to graduate. They're like, I didn't know nursing did this, or I didn't know this person has had the same journey I've had, and I didn't know I can do this. And so I think it's important that even within the schools that we continue to try to develop them and show them the different pathways, because nursing is so diverse as far as the things that we can do. There's a diversity in the things we can do. And I think the more individuals we expose to individuals like yourself who are nurse scientists and doing some incredible work, I think it's important.
Well, even in thinking about the PhD, I know you asked kind of what inspired their PhD, and I think for me it gives me such flexibility and an opportunity to be curious and to execute on questions that are commonly raised in the clinical areas. And being at Johns Hopkins, I completed my PhD in 3 years. Now, remember, I told you I was a first generation college student and first generation PhD student. So I had no idea what a PhD was. I had no idea what that path would look like. But I think for me, the goal of that program, I was supported by the Robert Johnson Future Nursing Scholars Program. And the goal of that was to accelerate the number of PhD prepared nurses across the country. Fortunately for me, I worked very hard and learning how to ask good questions and using my resources, I was able to complete that PhD. But just that's a caveat to say that people have different journeys when it comes to PhD programs.
Yeah, absolutely. I had a professor in my PhD program. She always used to say, "You are exactly where you need to be in the program, right? You're exactly where you need to be." And I think that was just such sound advice, because we do ourselves a disservice when we start comparing ourselves to other individuals that are on the same path but at the different points, right?
Absolutely.
So I mean, I think it's human of us to do that, but I think we also do ourselves a disservice when we do that, because we're all at different points. So I'm in agreement with that. Now let's talk about your work now, because you're doing a lot of incredible things. So let's talk about your body of work now, and then we'll caveat into all your side gigs as chair and co-chair. And so so let's talk about your work right now and the nursing component in that.
Absolutely. Um, so I am currently in Boston, and I am a faculty member at the medical school, at Harvard Medical School. And as you mentioned in the bio, I also have clinical responsibilities in terms of being a clinical nurse specialist in a BMT, bone marrow transplant. For me, the faculty position has provided numerous opportunities, being able to learn how to become a leader in both palliative care research, particularly with family caregiving research. And I'm leveraging all of my unique personal and professional networks and experiences to really look at this body of work. So I would say my overall goal is to develop interventions to support family caregivers of people who are going through serious illnesses. I always joke and say that if we don't learn to recognize and support family caregivers, we're going to end up with twice the number of patients than we have now, because we're not taking care of them. We're not seeing what they need. We're not oftentimes acknowledging them. So that's kind of my overall goal, to really be able to find ways to better support them and integrate them into the healthcare system. And so I have a couple of different research projects, but they all kind of have a common thread of thinking about those family caregivers who are most vulnerable. And that includes individuals who are taking care of adults with advanced cancer, with incurable cancers. That's a really tough population, because oftentimes these caregivers are more outpatient than they are inpatient, because the patients aren't necessarily receiving care and being seen as frequently when the goal is really just palliation and end of life care. And so, that's a really unique population. I think as we consider those individuals, we want to help them with having tough conversations with loved ones. We want to help them learn to assess and monitor symptoms better. We want them to feel equipped and prepared when they're at home and know when to call for different medical advice and support. The other types of populations that I'm caring for in my work right now is really looking at caregivers. I'm doing a large retrospective study of caregivers of older adults. And with this particular study, I am looking to see how family members are involved within the healthcare system when these patients are hospitalized. These are older adults with serious illnesses. And I'm looking to see, are notes about family members being documented, and do we have information about educating these family members before the patient gets discharged and goes home? Also understanding, is there an association between family involvement and palliative care use in this population? And then finally, thinking about if we're documenting about these families in the healthcare system, is it having some sort of impact on readmission rates and cost? I'm at the beginning stages of this study, but we're using machine learning, natural language processing, and Medicare claims data to really understand all of the nuances and factors that's involved with certain outcomes. And then finally, one of my last major projects is really focusing on caregivers of people undergoing bone marrow transplantation. As I've shared earlier, this is really near and dear to my heart. These individuals, for the transplant process, caregivers are often required because it's a journey that includes complications, unexpected outcomes, symptom burden, as well as a financial burden for these families. So this is a really key target population of caregivers to really help them understand the transplant process and feel prepared to take on quite a role that's often kind of a lifetime role.
That's incredible work. Now, as you're talking about this, I'm putting my educator hat on, and how are we doing from your perspective, from a profession perspective? How are we doing in educating our nurses on how to interact with caregivers? Because so much emphasis is placed on the patients and clinical outcomes and nursing outcomes and stuff like that. As you're talking about all this, and my time on the clinical side and in academia, we don't spend a whole lot, my perspective, we don't spend a whole lot of time around what the caregiver is saying, what they're doing, even though we are holistic and we're like, we want to treat the whole family unit or the caregiver and the patient. How are we doing on from the professional perspective? How are we doing on taking care of or interacting with the caregivers?
Oh, that's such a great question. And I have so many thoughts. So I'll just lay it out first by saying, we have over 50 million family caregivers right now, and that number is growing because of the pandemic, because
Right.
people are, uh, having ailments and diagnoses that they otherwise wouldn't have. And so that number of caregivers is growing. There is a growing national interest in family caregivers through policy and through research. And so I will point out that kind of prevalence. We're also seeing a shift in caregivers from not just being the baby boomers, but also younger adult caregivers. 1 in 4 caregivers are part of the millennial generation. So we're
Oh,
seeing that caregivers are getting younger and younger, and those needs are very unique from baby boomer caregivers who may be retired and already raised their children. So we're seeing kind of different needs, different demographics for caregivers, first of all. The other thing I'll say is, as nurses, we do really well with acknowledging the whole family as a whole in general. I think when you're starting out in nursing, it can be intimidating talking to the patient, let alone the family member, and let alone the family member being very involved in the care. That can be really intimidating for a new nurse. But I also want to point out that in these situations, the family members are very stressed. They're stressed for a variety of reasons. So I think we must remember that when we're taking care of patients and families and how they may communicate um, with us, or how they may or may not uh, remember certain information that we give them every day. They're just overwhelmed and stressed. But I will say our profession does a good job acknowledging the family unit as a whole. I think there are things that are already ingrained in us, such as providing patient and family education. That's something that is often a mandate in many hospitals. That's a part of the nursing scope of practice. I also think that when it comes to discharge planning, we do try to ask or involve other people outside of just the patient to make sure that they're prepared. But I do think in general, family meetings in particular are kind of challenging in an area that we need to continue to grow in as nurses. So family meetings are really just a gathering of a patient's family who's really involved in care to really discuss the goals of care, preferences, the patient's wishes, and any concerns and challenges that the patient or the family has. These could be difficult conversations because they may be talking about a change in regimen, or they may be talking about end of life care and what to do after that. So it really does vary. But I think as nurses, we're with the patients 24/7. So we have a good idea in terms of what questions they may ask, and reminding them to ask certain questions, bring it up in family meetings and rounds, and reinforcing whether they heard the information that they receive in rounds or these family meetings. So I think in terms of educating nursing students, we could do a better job with kind of assessing those skill sets in terms of how they communicate with family members. Because at the end of the day, we want to make sure that the patient's health is going to be optimized. And although a lot of attention is on patient health outcomes, caregivers are the ones who play a big role when the rest of us are not in the picture, when they're back at home. So although we do spend a lot of time with patient outcomes, we have to kind of think how the caregiver outcomes influences patient outcomes.
I agree. And as you're talking about this, like I know, like one of the things that I've seen work where the family has been really purposefully been brought into the conversations, like I like in the ICUs where they do interdisciplinary rounds, things like that, where they include family members. I know they're very effective, but things like that don't really exist as a norm in other units. You usually ICU something like that, but not in other. I mean, obviously with peds and stuff, you're going to include
Yeah.
the family. That's kind of the big part of it. But from an adult or even a gero perspective, that though that purposeful thing for me has a lot of times has been missing, and that's why I asked the question. But I
And
appreciate you.
just to follow up with that, so my clinical practice is primarily in pediatrics, but my research is in adults, in terms of family caregivers of adults. And Honestly, I decided that that was a gap that I wanted to address because pediatrics often do things really well when it comes to integrating family and making sure
Right.
the quality of life is optimized. And I think we can learn some things from the pediatric literature and pediatric specialty when it comes to having those tough discussions and involving family members. And one other thing that I think as nurses we should remind our students about is that patients live in a very social context. And these family caregivers, when they're living well and they're doing well in their role, they're contributing to that. And, you know, I think for me, family caregivers need to be recognized, they need to be valued. And that's part of one of my major research studies, seeing how are we seeing them in healthcare, because the need to really retain caregivers is fierce, especially now in the midst of the COVID pandemic, not needing anyone else to be readmitted. um, and, you know, and they do contribute to not having those patients readmitted unexpectedly.
Oh, that's great. Thank you for sharing that. Um, so I do want to spend a little bit of time talking about your all your side jobs that you're probably, I don't know, you're probably not getting paid for to do this extra work. Uh, but you're doing a lot of work in leadership roles with a number of different organizations. What's the driver for you to get involved with these other organizations and not just be a participating member or just being a member, but you're taking an active role in steering the work that these committees and these organizations are doing. What's the driver behind that?
This is a great question as well. You know, I think for me, the driver is being able to find joy in what I'm doing and being
Mm,
reminded that what I'm doing has a purpose, being focused on that. Again, like you say, not comparing where I am with other people, because for me, it's really about the patient and family. And when I keep that in the focus, I get rid of my imposter syndrome, at least temporarily, because I recognize that, you know, this work isn't about me. It's about the patients and families who are ridiculously impacted by serious illness. So, you know, I think one of the drivers is loving what I'm doing, and of course being content where I am, but also having a vision for the way forward. Um, and I think when we think about leadership opportunities, I've had and do have currently great mentors who are helping me, you know, prioritize, you know, what is it that really is needed? What, you know, what do I really want to be a part of? So, you know, I think recognizing you can't do it all, but when you are involved in something from a leadership perspective, you want to give your 100% effort. Um, and, you know, I think the other thing when it comes to leadership opportunities in general, you know, as a researcher and as a leader, I've learned to embrace failure and rejection, because those are the things that show that you're still in the game. You know, like you're still being active, you're still being mission focused. And, you know, I learned from every type of failure, rejection, feedback from those individuals, and just knowing that that doesn't that's not who I am, that doesn't define me, but it helps me to kind of move forward and grow. And it helps me to be a better role model and mentor to those who are coming behind me. Um, and the other thing I will share is, as a Cambia soldier and scholar, I'm learning about leadership in palliative care. And I recognize that palliative care, which is a kind of a team-based specialty, which really focuses on optimizing quality of life and reduce suffering for individuals across the illness continuum, not just end of life. So, helping optimize quality of life for people from diagnosis to end of life care or survivorship. And in this program, I'm learning that as a leader, I'm not always going to get it right, but I'm learning along the way and giving myself grace. This is so I'll just briefly kind of go on a tangent for a second. When I first started as a nurse, I always had this mantra that said, um, I'm going to leave my shoes at the door. And what that means is when I started the first 9 months of my career, one of my colleagues who started at the same time had a really bad accident. after a night shift, and she was really sick. She's okay, thankfully now, but that moment taught me that in the midst of the hustle and bustle with what we're doing, we need to remember to just get to our destination safely, get back home safely, and then leave it there, leave whatever challenges or stress that we have. So as a leader, I kind of extend that same grace and reminder to myself. I do the best that I can with the time that I'm given. So I think that's one thing that I try to keep in mind as a leader. And I also will recognize that I am an extrovert and introvert, but I've learned to kind of see beyond my own kind of initial expectations of myself. Because again, when I keep the focus on my true mission, that helps me kind of branch out and think about these leadership opportunities that should be done. Especially when I think about being a palliative care leader, where palliative care should not be a hidden gem. This should not be a secret. We should not have an underrepresentation of minorities in receiving palliative care. Access should not be limited. So when I think beyond myself, it helps me as a leader.
That's awesome. As you mentioned leaving your shoes at the door, I have a similar to, I say leave your suitcase at the door because, or leave your baggage at the
Yeah.
door, right? Same concept, but yeah, I never thought of it as a way of extending it to myself when I have my own shortcomings, which is very wise. Thank you. Thank you for sharing that.
Well, and I emphasize that because research is such a long game, and it's a marathon, not a sprint. So, and part of it is to learn. The part of being a researcher is about being curious, and it's also about being patient, and that comes with the research and with ourselves.
That's great. I've made a whole bunch of notes as we're talking. Now, mentorship, well, two things, mentorship, and then we're going to talk about your extroverted introversion. Because I'm also, I always tell people I'm a huge introvert, but I've learned to be an extrovert when I need to. But it is quite draining. After this podcast, I'm going to go and take a nap probably. But I want to talk about mentorship first. How do you choose your mentors, or do you?
I do. I do choose my mentors. Sometimes they choose me. When I started this journey of nursing, even from the very beginning, I've recognized that I couldn't do this work by myself. That could that I could learn from so many others who have already come before me, and I learned to accept that there are people who want the best for me. So when I think about mentors, I think about people from diverse backgrounds, racially, ethnically, age-wise, experience, discipline. I think part of being a good researcher is to read widely, is to be bold, to think big, think differently. And with that, those interactions with the different mentors, I'm pushing myself all along the way. So I do. When I have a potential mentor, the mentors that I have now, they can attest that I've reached out to them, and I was consistent and persistent, because I knew that there were things in my skill set deck that I wanted to enhance, that I felt like that they had experiences to help enhance. And I also realized in choosing my mentors that they were focused on my success. They were focused on my growth. And they met me where I am. Even the ones who are outside of my discipline now, they are really learning about nursing, learning about the value I bring, and I'm learning from them as well. And so I think when it comes to choosing mentors, you may be surprised sometimes in terms of who they are and who's in your corner. But it will often take initiative on your part, and doing your due diligence, reading about them, sharing and communicating your needs, and why you're interested in working with them.
Yeah, I think you hit on a great point of knowing where your own sort of knowledge gap is or experience gap is, and seeking out individuals that could walk you through that process. I think is extremely important, because so many times, like I'll have somebody will reach out to me, and I talk about this to my students all the time, is I'll have somebody that reaches out to me and says, would you be my mentor? And I'm always happy to step into that role, but I always ask them, what
Wow.
is it you're looking to get out of this mentorship? And sometimes I lose them at that point and they never come back because they know they need a mentor, they just don't know why. And I always tell them, I shouldn't be the one that sets your agenda as to where you want to be in your career, right? I think that's something that they need to do some soul searching and come and say, this is what I need. I don't know. I just don't know how to get from A to B, right?
That's
Uh,
right, because you could easily have mentors. Some of the best mentors, often the best mentors, are really busy. And so, what my mentors share with me, kind of the first time I meet them, all of them have really kind of said this in different ways: is, be prepared, send me the agenda ahead of time. Sometimes we only have 30 minutes, so let's make it count.
yeah.
So I think just being responsible in that way, in terms of taking the initiative, and seeking out a mentor, is really important.
Yeah, definitely. And I appreciate the fact that you mentioned other disciplines, because I right now, I think it may even be the first time that I've had a mentor that is not in my discipline, completely a different discipline, but what I needed the knowledge for is not necessarily discipline specific. And she has the knowledge that I need for what I need. So, so it's super important that we do have the ability to not just kind of put blinders on and say nursing, 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 because nursing may not have what we're looking for. So thank you for mentioning that.
Well, and
Um,
in my current circumstance, so I mentioned I'm a faculty member at the Harvard Medical School, because there is no nursing school here on campus. So I've learned to really embrace and love my transdisciplinary mentors in this space, and I think that has been a learning experience in terms of communication and in terms of what it is that I bring. But it's also allowing me to physically have a place in an environment that wasn't necessarily built for nurses, that doesn't have a lot of nursing representation in terms of the sciences, but bringing in our value and our perspective in this work is so important. So trailblazing is not easy, but it's worth it, because there's other people who are watching you and seeing that this is possible.
Yeah, and I was going to ask you, how was it going into that environment, knowing that it is not specifically a school of nursing, right? School of nursing, you're working with nurses, your students are going to be nurses, but you're the outlier, so to say, right? So how does that work for you?
I think in general, you're right. There is not too many of us here, but it's a growing number, and we're doing fantastic, amazing work that's being received by the university and funding agencies alike. But I would say surrounding myself with advocates of nurses. So the
Mm,
mentors that I that I have now are going to be lifelong mentors. They are advocates for the profession, and they really are kind of embracing what it is that I want to accomplish. So, it is, I think for me, it was a new opportunity to really be bold, to really to be a leader, to really make a difference. But there's intentional steps that I think are required. Just knowing your environment, knowing the mission, but also showing and demonstrating how you contribute to that mission.
yeah, I mean, you didn't accidentally fall into that role. Obviously, you worked for it, and you had the skill sets to step into that role. So, but it's I appreciate the fact that you're in a different discipline that appreciates the work and the lens of nursing in that discipline. So I think
Yeah.
that's key. But you're right. You do need to have the skill set to also bring to the table and be a contributor, not just be there because you're a nurse or because you're a scientist or whatever.
Yeah.
So that skill set is definitely important. Last thing I'm going to ask you is, is your because my students sometimes ask me when I share with the fact that I'm an introvert,
Mhm.
but I have learned to be an extrovert when I need to. How was that transition for you, and how did you force yourself into that? Because we needed to network, we needed to teach, we needed for a lot of things. So how did you do that? And this may not be an easy question, but
So for me, I think that I've learned to embrace being more of an extrovert, probably when I started nursing school. And I have an identical twin sister, and I think I may have mentioned that earlier. She's very outgoing. She's such a strong leader. And when we were growing up, I could just hang out in her shadow. But when I started nursing school and I had to interact with patients and families, I was like, oh, she's not here. I have to step up. Um, and, with the things I used to tell my students when I was teaching on faculty at UNC was if I teach you nothing else, I want you to learn how to advocate for yourself and for your patients. And for me, that pretty much covers everything because you have to be bold. You have to ask the questions to the rest of the team. You have to make sure that patients and families feel supported. So I think for me, I made that transition starting in nursing school. So I have my clinicals to really support my clinical experiences to really help me in kind of moving that forward. I think the other thing is being really skilled at establishing relationships. I think nursing also taught me that too. As I mentioned earlier, seeing patients when they're most vulnerable in different hours of the day and night when other people are not there. You learn how to carry a conversation. You learn how to listen very intently, and you learn how, in the midst of witnessing suffering and unexpected changes, all the time, you learn how to look at life a little bit differently. And that includes how you um, interact with others and the message that you're leaving behind just by your presence. So for me, those are the things that's really helped me kind of move past um, being from just an introvert, but also moving towards being an extrovert.
great. Thank you so much. Um, uh, I lied about the last question. I'm going to say
Oh,
one more thing.
please.
Uh, anything else you want to? I want to be cognizant of the time. Anything else you want to share with us before we end this podcast?
Well, I think I'd like to first recognize the enormous impact that COVID has had on our profession and on patients' families. So I do want to mention that first. And then the other thing is I want to share a few tips and insights for all of us, for me to remember and for my colleagues and the students who are coming up behind us. I think for me, COVID-19 has definitely heightened the importance of listening to one another, responding to each other, in addition to witnessing suffering and challenging situations. And never before have I seen this in such plain sight. I think the disproportionate burden of the pandemic on minority communities and older adults, and now young children and families have really illuminated the disparities in a very devastating way. We have patients who will normally be discharged to a skilled nursing facility or an assisted living going back home, opting to return home. And that leaves many family caregivers with the um, enormous task and little preparation and resources to take care of these individuals. So I think just having people being discharged too soon or not going where they initially was recommended to go in terms of care facility and going back home, we need to continue to keep in the forefront of our minds. Caregivers are also having enormous need as a midst of this pandemic. Also, I want to share with COVID-19, it has placed a lot of emphasis with the no visitor policy. It's placed a lot of emphasis on family caregivers, their presence in their absence. And what I mean by that is because they weren't able to be there, we saw what a true impact that they made just from getting water for the patient or helping to turn the patient. And when they're not there, we're now seeing it. And I'm so glad that there are opportunities that's coming up from this pandemic, like recognizing family caregivers, like recognizing the need for better care coordination, like recognizing the need to really think about advanced care planning and goals of care and what it means to live life in a dignified way up until the end. So I do want to point that out. I think in general, when we, think about when people think about going into the profession, I think we have so many nursing programs now that's allowing direct entry and master's level entry and so many different education programs in nursing that, I think for faculty, we must learn to embrace the diversity and the different viewpoints that these students are bringing to our profession. And that means some have had previous careers that really, if we combine that with their newfound nursing knowledge, we're able to accelerate the profession, improve outcomes, change and reform the healthcare system, inform policy. So I think embracing differences from our nursing students is so important. I also think that we should all see ourselves as leaders. And that doesn't mean wait until you have a title. That doesn't mean wait until someone tells you that you're a leader. It's really about being a beacon for your colleagues, for being, for being an advocate for your patients. So I think those are some of the things that I wanted to highlight. I also want to just emphasize that, each person can make such a valuable difference in this world, and just staying focused, staying disciplined, and learning to embrace where we are in this time when it comes to technology, using it to our advantage to reach individuals who otherwise would be left out of the system, forgotten about because they can't physically get to a center. I think being able to have a strong foundation in terms of when you're thinking about being a nurse, strong foundation in your sciences, in your communication skills, of being able to kind of think beyond that and seeing what is it that I would be happy doing in this profession? How can I make a difference in this profession?
Great. Thank you so much. All very good and sound advice. So thank you for sharing that. Thank you for so much for sharing your time with us. We have been listening to Dr. Tamryn Gray, and we look forward to seeing you in our future episodes. Thank you, and have a great rest of your day. You've been listening to the RN Mentor with your host, Ali Tayeb. Please don't forget to visit www.alirtayeb.com. That's www.alirtayeb.com for podcast notes and resources, and don't forget to subscribe. Until next time, I wish you fair winds and following seas.